Welcome to this very important Silicon Slopes Live about a very important issue. As if you've been following the news and listening to our medical professionals over the past few weeks here in the state of Utah, you've noticed a spike in COVID-19 cases and a rise in everything happening there. And so we've brought on medical professionals throughout the various providers within the state from IHC, from the University of Utah Health. We have the Utah Medical Association here. We have the health department here, I believe, as well. And we want to talk about the importance of masks. And Dr. Stinyam, I'm going to have you start us out and give us an overview on what's happening and what Utahns can do to help slow and curb the spread here.
Yeah, thanks, Clint. Happy to chat with you and your group. As you all know, just like other states in the U.S., Utah has seen a really significant rise in cases of SARS-CoV-2, the virus that causes COVID-19. We had successfully flattened the curve for a number of months. April, May was actually, we'd done a really nice job. We were sitting at case counts between 100 and 200 counts per day. Things were stable. But really, starting a little bit after the Memorial Day holiday, we really saw a change in the pattern of the epidemiology here in Utah. And so what we've seen is a very significant rise in cases throughout the state. This isn't located in one specific county. This is not just Salt Lake County, Davis County, Utah. This is across the state of Utah where we're seeing increases in cases pretty significantly. We've now hit case counts over 600 on a number of days in the past couple of weeks. In addition, we're seeing increases in hospitalization. We're going to talk about that here in a little bit. We're also seeing these increases in the face of no increase in testing. So the number of tests that we've done has remained stable. It has remained stable for the past number of months, but what we're seeing is an increase in the test positivity. So this is not an artificial reflection of just more testing. This is legitimate increases in cases. What we're also seeing is that when you look at the Utah Department of Health data, you're also seeing that the number of unknown sources of infection is going up. So these are people that are diagnosed as positive, and when you ask them, how do you get it? They have no idea. In addition, we're seeing the number of close contacts per positive case going from 5 to 20. So that means,
good talk. All right.
So that's really meaning that social distancing or physical distancing, where we really focus on limiting number of close contacts early in the epidemic, really has changed, and we're now seeing more people having increased number of close contacts. So what this points to is an overwhelming, just an increase in community transmission of SARS-CoV-2. It's plain and simple. We're having increased cases. And really what we're seeing is an inflection point at Memorial Day. 5 to 7 days after Memorial Day, you start seeing this big increase in spike of cases, and it's really indicative of decreasing our social distancing. So how's Intermountain doing? To be honest, we're feeling the pressure of this. This morning, I rounded on 45 patients into one hospital. So Intermountain Medical Center, we virtually rounded on all COVID patients. Over half of those people were in the ICU. Most of the people in the ICU were on ventilators. And I can tell you this has taken a toll, not only just on the caregivers, but also clearly on the patients. Right now, as of yesterday, we had 178 patients admitted to our hospitals with COVID-19. That number prior to Memorial Day was 78. So we've well over doubled the amount of patients in our hospitals currently within Intermountain Healthcare. If you look at the state data, that doesn't necessarily reflect exactly what's going in our ICUs. I can tell you our ICUs are taxed. The ICU down in St. George is approaching capacity and looking at how do we expand beds. We have in Intermountain Medical Center, McKay, Utah Valley are exploring those options as well. We're getting close to capacity. We're feeling that pressure, and we have surge plans to be able to expand beds. But we just need to realize that when we are expanding into those areas where we don't typically have ICUs, we're not able to provide the level of care that we typically can when we are focused strictly on our current ICU capacity. So we're reaching that point, and if we continue this trend that we're on, especially if we see an increase in cases after the July 4th holiday and Pioneer Day, we are definitely going to be above our capacity in terms of hospital capacity. So it really kind of brings us to what we need. What we need is the community's help. We need the community's help to really stem this current trend. We need to absolutely 100% flatten the curve right now. We cannot tolerate a big surge after a July 4th holiday. We just can't. We don't have the hospital capacity to do it. And so we need everybody's help. And so it's simple. That recipe is simple. It's not easy, though. We got to have a renewed interest in physical distancing. We've got to have everybody wearing masks. No question about it. If people are out and about in our stores, in our places of business, the people need to wear masks that go in, and also the employers have to have wearing masks because it's effective, and the data is showing us that. And we need to continue to do good hand hygiene. So those are the things we need. And this is the ask from the healthcare network to our community partners: is we need your help. And I'll pass it over to back to Clint to introduce the next speaker.
Yeah, Dr. Pavia. Did I say that right? Oh, you're on mute, sir. Sorry.
Fix that. Yes. Anyway, you did well, Clint. Thanks.
All right. So I told you I was going to screw it up, and I even asked you about it before we came on. But I want to ask you a few questions, and there is this, as Dr. Stenyum just said, there's been an increase in the number of cases since Memorial Day. Do we know what led to that increase? Why that increase has happened?
We have a very good idea. We know what it isn't. So there aren't big outbreaks that are driving this. This isn't all hot spots in one place. We're seeing illness all over the state. We're also seeing that a lot of the new infections are in younger people. And we've done people a disservice because we say younger people are at decreased risk of complications. That means on average, if you're 30 years old and you get it, you're less likely to end up in the hospital or in the ICU. But if you're the 30-year-old who dies, that lower risk doesn't really matter. And we're seeing a lot of disease in younger people that's leading to more hospitalizations. But what we've seen throughout the state, you just have to go to a neighborhood store or to a restaurant to see it, is when we opened up business, we thought as a community that everything was okay. And we started to congregate and get too close to each other and not wear masks and gather in larger groups. And I think a lot of the problem is that we really have conflated the need to get back to work with the sense that it was all over, because we needed to get back to work, but it was by no means all over. And we really needed to keep our guard up, which we have not done as well as we needed to.
So does mask wearing cause health issues like decreased O2 levels, increased CO levels? I know that there's been some of that out there.
Yeah, like a lot of things around this epidemic, that's all misinformation. Masks don't cause any decrease in oxygen levels. Otherwise, your surgeons would be falling over at the operating room table, and they're not. And by and large, there's really no issue with increased CO2 with typical masks. Now, the very tight-fitting N95s, if you use them while exercising, may increase your CO2 just a little bit, but not enough to cause health problems.
Dr. Arch, I want to go to you, and I would love everyone to weigh in here who is on this call on this particular one. I have a mask here that my wife has sewed for me, and I know a lot of people are wondering what type of masks should people wear, and is it true that like cloth face coverings don't prevent COVID-19? You're on mute, Dr. Arch. Sorry. You actually muted and then unmuted. There you go.
There you go.
Oh, it's going. You're back muted. Interesting.
Somebody's muting me on your end, I think.
There you go. We can hear you.
Okay, good. So masks, there are several different types of masks. No mask is perfect, so that everyone understands that. We're talking about decreasing the spread. We're not talking about eliminating it. However, we know that even a cloth mask will prevent the spread of large amounts of your own droplets, your own respiratory droplets, which would contain virus. It keeps them towards you. It prevents them from going to someone else who might breathe them in and then become infected if you happen to have this virus. Please know that you need to cover your mouth and nose, not I love when people do it underneath their nose or hang it on their chin. That's not helpful. The other thing you need to know, and I think it's been pointed out here, but people can transmit this virus. They can be infected with it and they can transmit it without ever knowing that they're sick. You're most infectious prior to developing symptoms. And children in particular may have very minimal, if any, symptoms. Young people the same. And so you can transmit this to people who are more vulnerable. And as Dr. Pavia was saying, people more vulnerable are spread throughout the community. They are not just what we want to believe. People want to believe that it's the 80-year-olds who are at death's doorstep, and that those are the only people who are going to be significantly affected by this disorder. But that's not the case. I have children in my clinic who are immunosuppressed, who have other health problems, anyone with cardiac disease. There are many, many risk factors, and they're spread throughout the age groups and the community. Diabetes, for instance. Sorry, I probably answered more than you wanted to hear.
No, I appreciate that. And then there's somewhere you can put like these inserts in. I believe even this one might have that or not. Is that useful? Are those inserts useful?
It probably depends on what the insert is. Anything is useful. So a bandana is useful if it covers your mouth and nose. Is it as good as a three-layer mask, perhaps with a filter in it? No, but anything is better than nothing.
I like the mask because it covers up my mustache, which I've inexplicably decided to grow out. And so it just makes it a little bit easier. Dr. Pavia, go ahead.
Well, I was going to say, masks are very good at preventing you from spreading the virus to someone else. They will also provide you some protection against the virus coming in, but that's where the difference in the types of masks make a bigger difference. But if two people are wearing cloth masks and they're both protected, that is terrifically effective. You don't need a fancy N95 if everyone around you is masked.
Dr. Stynium, how would you recommend, from IHC's perspective and from the medical field's perspective, how companies, because you have a lot of companies, a lot of CEOs, a lot of leaders watching this right now, how do they effectively create social distancing in the workplace for both their employees, and then you've also got, businesses that have customers that come in? What's the best way to do that? We've got you on mute as well, Doctor. There we go.
How about that? There you go. Can figure this out. Yeah, I mean, I think it takes leadership in this. We have to have this from both the customer standpoint and also from the business standpoint. And you can see a lot of businesses getting very creative in terms of how they create physical distance in their flow of customers within their business, whether it be directional flows in grocery stores or markers that show people that keep 6 feet away, the plexiglass we're seeing throughout. I mean, I think really just making this the new normal right now and setting the expectation that this is an expectation of our employees. And we've seen definitely transmission of this virus amongst employees, but also making the expectation that, hey, we need to keep our employees safe by also having customers come in with masks as well. So I think this really is on both, not only just employers, but also in the community, and setting that expectation is we want to provide a service to you, whatever that service may be. And in order for us to do that and continue to do this throughout the pandemic, we have to be safe. In order for us just to continue and sustain our business and our growth and our economy, we both have to be safe. And that starts with both the customer and also the business.
Michelle, how is the Utah Medical Association working with businesses, and what are their recommendations during this spike here?
The same as what has been said by all of the physicians that are participating. We might want to use the term, rather than social distancing, safe distancing or physical distancing. And I know, like one of our physicians that just spoke said, because I think what is happening, particularly with some of the younger generation, is they're saying, I don't need to, I don't like the social distancing piece, right? I want to be with my friends, be able to interact and everything else. People can still interact. We're just saying they need to be a little bit further apart, right? And they need to wear the mask to protect. You're wearing the mask, you're protecting others. Others need to wear the mask to protect you. And then that way we protect all the vulnerable population out there, and we don't know all who everybody is. As all of the physicians here know, and as the physicians in the medical association are seeing, this virus changes from day to day, or information on the virus, and since it is so new, we need to push for just the things that people can do. It's just a small thing to do to protect everybody and to keep the economy open, to keep businesses open. It is the intent, and we do want to keep businesses open. We don't want them closed. We want the economy to work, businesses to stay open. And in order to do that, we're just saying, look, it isn't that much to just say, have a mask on, have a little bit of physical distance between people, and then also wash your hands and do that. That is not too much to ask anybody out there to do, to keep the public safe and to keep us open, to keep businesses open. So, I mean, I think that's our big message that we want out there.
Dr. Pavia, we have this color-coded system here in the state of Utah, and we were at orange and we're now at yellow, and there's been some discussion within state leadership of moving some of the state to green. And there's been, a lot of discussion over the past couple of weeks about moving us back to orange. I mean, I don't want to put you on the spot here, but how are you feeling about that system, and would you have any recommendations to the state on changing colors or anything like that?
Well, I think we've made a mistake in the communication, because the idea of red, orange, yellow, green was supposed to be that we'd carefully follow how are we doing with flattening the curve and then getting things to go down. And there were really two aspects to it. There was opening up business, and then there was the degree of risk. And unfortunately, we tied the risk to opening up businesses because our risk has gone up dramatically from where we were. It's worse than it was when we were red. And yet we are able to open businesses. We are able to get some of the economy going again. So I think we need to rethink things. I think we need to separate out how we talk about risk and what we need to do to protect ourselves from what we do with the economy. And I think it's because early on we developed this sort of false tension between either it's all about health or it's all about the economy. And that was wrong from the get-go. A good economy makes us healthy. It puts food on our tables. It gives us our chance to go to see the doctor. And the two really aren't in conflict. In fact, the better our COVID-19 rates are, the more competitive we are with our neighbors for tourism, the more we can keep our businesses open, the more safe it's going to be to get kids back to school in the fall. If we can't get the numbers down, we can't reopen schools. If we can't get our kids to school, many of us who don't have the luxury of telecommuting probably can't go back to work. So these are all really closely tied, and we need to think about it differently.
Dr. Arch, I want to double click on what Dr. Pavia just said there around opening schools in the fall. Are we going to be able to reopen schools in the fall if the rates continue at this rate?
Honestly, I don't see how we will be able to. Asking the community to wear masks hasn't helped fast enough to prevent the rises that Dr. Stenham was talking about in our case numbers. Children being at school together in groups without being able to physical distance or wearing masks is going to cause that infection to rise. They're going to bring it home to parents who then will get sick and won't be able to work. So that it will harm our economy, and I suspect that we'll need to shut down. I didn't say previously when you asked about masks that the last study I saw, if we both wear a mask, the transmission rate is 85% lower than it would be without masks for COVID-19. Distancing is similar, 85%. So here, just particularly if you can do both, that's great. But if we could open with our students wearing masks as possible or social distancing, we might be able to handle it. But that means we need to do something now. In order not to be at that place where there are too many infections and the hospital is overwhelmed by the time school is ready to start.
So if you wear a mask and you social distance and everybody around you wears a mask and social distance, there's an 85% less of a chance you contract COVID-19. Why anyone would not follow those pretty basic guidelines makes no sense at all. Dr. Stynium, I want to ask you, we've seen large gatherings over the past couple of weeks, and this isn't a commentary on those gatherings. Some of them are protests that are crucial, and some of them are concerts, which seem less so. But nevertheless, from a health perspective, we have seen mass gatherings since Memorial Day, which is kind of when you've said we've started to see this spike. What advice do you have, just from a medical perspective, around those gatherings and how people should interact at those things?
Yeah, I mean, I think the first thing is, reflecting on the good news. We saw a number of protests in Salt Lake, and, from the health department, we have not seen a massive uptick or outbreak secondary to those outbreaks. And so that's a really good thing. And that was something we were really concerned about, because we saw plenty of people gathering and protesting, and we didn't see a significant number of cases coming from that. And I think that speaks to a couple things. One is you did see a lot of people wearing masks or face shields at those protests, and it was outside. And so when we're thinking about gathering, things that we think about is do everything you can to decrease the number of people you're interacting with. And so big gatherings like concerts and those things, is this a necessity or is this a luxury? And really focus on those things, and avoiding those large groups is absolutely essential. And especially avoiding large groups that are indoors. Indoors where the ventilation is just not like it is outside is a really high risk for infection, especially if it includes yelling, screaming, singing, really, really high risk things. And so as we move into these holidays, things to think about are really focusing on, if you're going to engage with people, engage with them outside. Try to maintain at least 6 feet of distancing from yourselves, and try to really maintain a small number of people at those gatherings.
Dr. Pivia, what precautions should people take at home? I've got you on mute, Dr. Pivia.
I'm a slow learner, apparently.
No worries. No worries.
So, we talk about your bubble. So when you're at home, you're around your family and people who you're going to be close to most of the time. What is going to increase your risk at home is the interactions that each person in your family has when they're not at home. So if, you have a family member has to go to work in a crowded setting, they need to be able to protect themselves. They and their employer need to be able to do everything that is needed to help keep them safe at their workplace. If your kids are going back to school, we have to do everything we can to make school safe. If you can do all those things, then at home, you really only need to follow the basics: good hand hygiene, covering your cough, not going to work when you're sick. It's really the workplace and the public world where we're at most risk. And if you don't mind, you asked Eddie earlier about what employers can do to make their workplaces safer. And we talked about physical distancing. We talked about employees wearing masks and having customers wear masks. But there are also physical things that you can think about in your workplace. Can you increase the ventilation? Is it, at least before it gets too hot, can you have the windows open? Can you decrease the number of people who are in the office or at the work site at any one time? Can you re-engineer a task on a job site so that fewer people need to gather around the same piece of equipment? We really need to be very creative about this and find experts to help us with it.
Dr. Arch, there's been a lot of questions around the circumstances when you should or shouldn't wear a mask. When you're in large groups of people, going out shopping, a lot of it seems very obvious, at least to me. Under most situations where you're going to be interacting with people, if not all situations, you should be wearing a mask and practicing social distancing. But what about and we got this question, do you need to wear a mask if you're running alone outside?
I think that most of us would agree that if you're running alone outside and you are not in close contact with others, that you would be fine not to wear a mask. have been concerns that when you're running, because you're breathing heavily, that you can expire droplets up to 12 feet. So you want to stay a distance away from other people. But if you're alone, I don't see that as important. Does anyone else on the panel?
We're learning more and more about the safety of doing things outdoors. And so I think when you're exercising outdoors and you're not really close to people for a long period of time, that's still very safe relative to other things. And I personally don't wear a mask when I'm riding my bike or hiking with friends, although we do try and stay a few feet apart.
Doctor, and I would actually love all of you to weigh in on this. There's been a lot of, particularly over the past week to 4 to 5 days. But Dr. Previa, I want to start with you on this question, and about this discussion, which I mentioned has been going on lately around mandating masks, like the government mandating that citizens wear masks. We've seen, I believe, Salt Lake County has done that. Would you recommend that happens statewide?
Well, I think we've created a discourse around mandatory mask wearing that's really all wrong. We don't let people smoke inside of restaurants or places of business because the small infringement on my freedom to smoke greatly puts your health at risk. We've also seen that, asking people nicely to do it hasn't worked very well because people haven't seen the urgency. But probably the most important reason is that I think mandates are actually good for business. And I've talked to a number of business leaders who feel this way. If I have to ask everyone coming into my place of work to wear a mask and everyone else does it, I'm not the bad guy. The government has suggested that. And I'm on an equal playing field with my competitor down the block who has to do the same thing. It also makes it easier for me to feel comfortable that my employees are going to be safe and I'm not going to shut down in 3 weeks because they're all sick. It's also good for business, again, because it makes us more competitive. People want to come to our place of business. They want to travel to our state to enjoy the tourism. So I think the time has come for mandatory masking, but I think it's for all the reasons. It's not because big government is here to tell you what to do. It's because it makes it easier for us all to look out for each other.
Dr. Stenyum, what are your thoughts on that?
Yeah, I don't have much to add. I'm definitely not going to be able to say it as eloquently as Andy just did, but I agree with all of his points. I mean, I think we need to turn our focus on our responsibility to each other and not necessarily on our individual needs or individual freedoms as people are talking about it. This is public health. We need to keep our public safe. And we need to keep people out of the hospital so we can care for those with COVID and those without COVID. And we need to make sure that we maintain that safety in our communities. And so one of the ways to do that is wearing a mask. And so from my standpoint, everybody should be wearing a mask, period. And if we need a state mandate to do that, with that focus on the fact that this is due to responsibility for all of us to maintain safety and the integrity of our communities, then let's do it. But it really needs to be a focus on that responsibility.
Dr. Arch, I assume you agree?
I completely agree. I think people get caught up on this idea of personal freedom. There isn't anything in the Constitution that allows you to put put the public safety and the public health in danger. And so I think that we need to start viewing it as a commitment to our communities and stop thinking about it infringing on our personal rights. I can't say it as beautifully as Dr. Pavia did. I also think that people focus on the numbers, the death rates and the numbers of actual patients and things, but they don't necessarily focus on the fact that we have a baseline number of heart attacks. We have a baseline number of people with cancer. We have a baseline number of ill people who may or may not in trauma, who may or not need the ICU. And so it's not just COVID-19, it's that COVID-19 is overwhelming our system, our ability to manage those people as well as the COVID-19 patients. And so we need to take action to protect us all, not just a handful.
I really like this smoking analogy. I mean, it seems to be spot on. We don't allow people to smoke indoors because of the risk that poses to others. It seems like this should be treated very similar. Michelle, from the Utah Medical Association's perspective, is this something that your association is working on with government leaders to make happen?
Yes, We are. I agree with everything that each of the doctors have said here. You know, you also have in a lot of businesses, you have no shirt, no shoes, no service. I mean, I think that we need to say no shirt, no shoes, no mask, no service, right? We can push this forward and again on the message that this is protecting everybody, whether you have COVID or not, and then helping us stay open and stay in business and keep our economy going. And I mean, that's the bottom line. We want to do that, then that's something that everybody can just do this one little piece to make that big of a difference.
Dr. Stenyum, I want to go back and end this conversation where it began, which is July 4th is coming up. It's this weekend. And, you know, as you mentioned, Memorial Day, we saw a big spike. This is a big holiday in some ways, maybe even potentially bigger than Memorial Day in terms of people going out and about. I'd love all of you to weigh in as we end here, but starting with you, Dr. Stenyum, around the best way that people can go about their lives, yet understanding we are still in the midst of a pandemic. COVID-19 still is here, and how they should interact with others and protect public health during this holiday weekend. Because as you mentioned, if we see a spike here, that could put hospitals over capacity.
Yeah, Clint, you know, to be completely honest, it makes me very nervous moving into July. The spike that we've seen as we move from red, orange to yellow coincided with Memorial holiday, with this almost tripling of our kind of baseline numbers and well over doubling our hospitalizations. As we move into another holiday, you know, that makes me real nervous in terms of what we can provide to our patients. It makes me nervous about our caregivers because they're already taxed, they're already working overtime, they're tired. And so we really need to focus on being responsible this July 4th holiday and moving into Pioneer Day, because you're right, it's a big holiday. And I think we all need to reflect on what is our social responsibility to our communities and how can we do that? You know, what does our individual actions contribute to the safety of our communities? And that is limiting gatherings, being outside, being as physically distant as we can while still maintaining some social interaction, and then wearing masks when you can't do physical distancing. All of those things have to be done for the safety of our community come July, because if they're not, the consequences are going to be pretty dire. And we need to really right this ship now. And if we don't, you know, I'm nervous to see what's going to happen.
Dr. Previa.
Yeah, I share Eddie's worry about what could happen if things go the way they have been with July 4th. So I'd like to, maybe we can think about it differently. You know, early on, Utah really kind of led the way and did a good job of intervening early and doing the things we needed to do. And we're not really doing a good job now. So maybe the 4th is a good inspiration to say, let's show some patriotic pride. Let's show what we can do to protect each other. I mean, Utah is a state that's born on kind of a can-do and community protection ethic. We seem to have lost that. Let's use the 4th to regain that in the 24th.
Dr. Arch, the medical community has come together to launch this social media campaign, Mask Up Utah. Can you talk about that? And is there ways that our community, the Silicon Slopes community, even just broader Utahns who understand the importance of this, can spread the word on Mask Up Utah to make sure everyone hears why this is important, particularly with the holiday coming up this weekend?
I think the best thing that you can do is share it with your friends through social media and through conversation. The difficult part for us down here in St. George is that we have been working with the local papers. We have public service announcements on the radios. We're putting out public service announcements through the hospital and the hospital's media. But we just aren't reaching the group of people we need to. And I think for the most part, that is people maybe 40, 50 and younger. And so it's been difficult. So I think the best thing is to share with your friends and have them share with theirs.
Well, I want to thank you all so much for coming on, particularly on short notice. We wanted to make sure that this message got out before the 4th of July weekend because it is so important and because that holiday does bring out people from their homes to gather and just to understand the importance of this. And so please mask up, Utah. It's a simple thing. I'm sure we'll have you all back on again, but I appreciate you taking the time. And yeah, Dr. Pavia, you got your mask on.
Oh. So Clint, I want to thank you for bringing us all together and helping get the message out. And I'll try and set an example.
Thank you so much, Dr. Stenyum. Thank you so much for coming on.
You got it. Happy to do it.
Yeah, thank you.
Appreciate you all.
Thank you. I'm at
Take
home.
care.
Unfortunately, I wasn't told to grab my mask.
I
Forgot to
just have
send the
it right
props.
by me all the time.
I'm in a
Thanks
20
so
by 10
much.
conference room alone, but it seemed like a good gesture.
It's all about leadership and the example, and you're all showing it. Thank you
Yeah.
very much. Have a good one.